Hello everyone, welcome back to my YouTube channel. So today we'll be talking about the chapter Nutrition and Health. So it starts by classifying foods based on their origin, their chemical composition, their predominant function and their nutritive value. Based on the predominant function, they can be classified into bodybuilding, energy giving and immunoprotective. And nutritive value, they can be classified into cereals, pulses, vegetables, etc. So we then move on to discuss the various nutrients found in foods, starting with proteins, the building blocks of our body. So we have the various elements that can be found in proteins, which are carbon, hydrogen, oxygen, nitrogen, sulfur, phosphorus, and iron traces, to name a few. Then essential amino acids. So there's a mnemonic given in Prasad's textbook of biochemistry. Mat will fly, and then the various functions of proteins, the sources of proteins which can be animal or vegetable, and then the supplementary action of proteins. So there are few diets that are deficient in one type of amino acid, which is called the limiting amino acid for that particular food item. For example, cereals are deficient in lysine and pulses are deficient in methionine. So if you combine the two in a given diet, the deficiencies neutralize each other. So we then have protein metabolism, and then we have the evaluation of proteins, which is measured by net protein utilization, which is equal to the biological value into digestibility coefficient by 100. We then move on to discuss fats. So there are simple fats, compound fats, and derived fats. Examples for simple fats are triglycerides, compound fats are phospholipids, derived fats are example cholesterol. Then we also have fatty acids, which can be classified into saturated and unsaturated. Saturated fatty acids are palmitate and stearate. Unsaturated acids can be divided into mono unsaturated fatty acids and polyunsaturated fatty acids. MUFA examples are oleate, and PUFA examples are linoleic acid and alpha linolenic acid. Then we want to discuss what are essential fatty acids like linoleic acid, alpha linolenic acid, and arachidonic acids. So which can't be synthesized in the body, so you need to have it purely in your diet is a pure source of essential fatty acids, so to say. Then we have the sources of fats, again animal, vegetable, and other sources. And then we also discuss visible versus invisible fats, and then hydrogenation of fats, and then trans fatty acids, and then fats and disease. So there are various diseases related to fatty intake like obesity, phrenoderma, congestive heart disease, cancer, just to name a few. There are many others. And the FAO or WHO 2008 recommendations for fat intake, and the choice of cooking oils, and the fat requirements for body. Then we want to discuss carbohydrates, in which the only important thing is the glycemic index. Then we discuss dietary fibers, what are the types and sources. So the types are based on the source, it can be cereals, vegetables, or fruit fibers. And based on water solubility, they can be water soluble or water insoluble. We then want to discuss vitamins. So they can be fat soluble or water soluble. A, D, E, K are fat soluble, B group or B complex, and C are water soluble. So we need to know the name, requirements, sources, deficiency, and toxicity of the same. And then there are various minerals like iron, phosphorus, sodium, potassium, magnesium, iron, fluoride, zinc, copper, cobalt, selenium, molybdenum, and dietary antioxidants. So these are all the trace elements which I have circled here. And then we move on to nutritional profiles of principal foods. So firstly, we have cereals and millets. Cereals can be probably rice, wheat, and maize. So under rice, we need to know the three parts of rice grain. What are the effects of milling, washing, and woking and parboiling on the quality of rice. And for millets, we have the most prominent millets in our country are jowar, bajra, and ragi. Then for pulses, we need to also know short about soya bean. And vegetables, we have green leafy vegetables, roots and tubers, and others. But these two are the main ones. Nuts and oil seeds, fruits, animal foods like milk and milk products, which include vegetable milk also, and egg, fish, and meat. fats and oils, sugar and jaggery, condiments and spices, and other miscellaneous foods like beverages which can be caffeinated like coffee, tea, and cocoa, and alcoholic beverages like beer, whiskey, rum, and gin, and soft drinks. It's not possible to remember the exact nutritional profile of each, so I would suggest remember protein and calorie profile of rice, vegetables, fruits, milk, fish, meat, fats and oils, sugar. That's all. We then move on to discuss nutritional requirements and what are recommended dietary allowance and what are bioavailability. And then we also discuss the reference body weights. So the average in adult is between 19 to 39 years, and the average Indian adult male measures 1.77 meters in height and weighs 65 kg, and the average Indian adult female is 1.62 meters in height and weighs 55 kgs. Under energy, we see how to measure energy and what are the energy requirements, and short note on physical activity ratio, which is a short formula, and then the various sources of energy. So proteins give you 4 kilocalories per gram, fats 9 kilogram per gram, carbohydrates 4 kilogram per gram, and dietary fibers 2 kilocalories per gram. We then move on to proteins. So we start with the assessment of protein quality, in which we deal with the amino acid score, the net protein utilization, and then we also assess the quantity of protein. So in which we learn about the protein energy ratio. So the amino acid score is basically the milligram of amino acid per gram of test protein by milligrams of the same amino acid per gram of reference protein into 100. And the net protein utilization is the nitrogen retained by the body by nitrogen intake into 100. So the protein energy ratio is the energy derived from the protein source by total energy in the diet into 100. Then there's a small table given on amino acid requirements in the textbook, and also a small note on dietary intake. Then there are two tables showing the dietary requirements of fats and carbohydrates. And then we move on to discuss the concept of a balanced diet. And then the food guide pyramid, which was started in the 1970s in Sweden, which has gradually evolved into something called My Pyramid in 2005, which basically shows the profile of a balanced diet. And then there's also another method called My Plate for the Day method or My Plate method by ICMR. And then we have HFSS 2024 recommendations, that is high fats, sugars, and salts. So WHO has stated that more than 30 grams of fats per day, or more than 10 grams of saturated fats per day, more than 25 grams of sugar per day, and more than 5 grams of salt per day would fall into the high fat, sugar, and salt diet category. And then a short note on processed foods as well, how they affect our health. Then we move on to nutritional problems in public health. So we start with low birth weight, then undernutrition, and how it causes a vicious cycle, which is it has an important diagram on the vicious cycle of malnutrition, how it propagates between various age groups, and broadly due to infection or malnutrition and the influence of previous generations over the next generations. So under undernutrition, we have stunting, wasting, being underweight, severe acute malnutrition, and protein energy malnutrition, which is of kwashiorkor and marasmus, the two types. And a short note on early detection and preventive measures under the four headings of disease prevention. Then we have xerophthalmia, nutritional anemia, the epidemiology, effects, and various interventions to tackle the same, like IFA tablets, iron fortification, and other methods. Then iodine deficiency disorders, endemic fluorosis, and neuroletharism. The toxin causing neuroletharism, the disease stages, there are around four stages, and interventions to prevent the same. So we also examine the nutritional factors in selected diseases like cardiovascular disease, type 2 diabetes mellitus, obesity, and cancer, and the role of fats, dietary fibers, micronutrients, food additives and contaminants, and alcohol in causing various malignancies that we all dread. Next, we learn how to assess the nutritional status of a community. So we start with clinical examination of various individuals, and then anthropometry, and then biochemical evaluation, functional indicators, the assessment of dietary intake, vital statistics, and ecological factor assessment or surveying. Then there's also a short note on nutritional surveillance as well. Then we move on to the social aspects of nutrition. What are the various problems affected by social aspects like undernutrition, overnutrition, an imbalance in the distribution of nutrient rich foods in a community, and the specific deficiencies? And then ecological factors like conditioning and cultural influences, socio-economic factors, food production, and availability of health and other services like nutritional surveillance, nutritional rehabilitation, nutritional supplementation, and health education. And how do we prevent the various measures at family, community, national, and international levels? Coming to food hygiene, how to maintain the hygiene of various food items. So we start with milk hygiene. What are the diseases transmitted if you don't maintain milk hygiene, and the various methods to measure, that is the methylene blue reduction test, and then pasteurization and tests for pasteurization like the phosphatase test, coliform count, and standard plate count, and the methods for pasteurization, that is Holder or VAT, high temperature short time sterilization, and ultra high temperature pasteurization. Then we move on to meat hygiene and the diseases transmitted by unhygienic meat, and the requirements for a slaughterhouse, that is the location, structure, proper waste disposal, hygienic water supply, periodic animal examination, meat storage and transportation, and other miscellaneous requirements. And broadly, how to maintain hygiene for fish and eggs. Then we also have fruits and vegetables, sanitation of eating places, and food handlers. Hands, hair, white overalls, and habits must be hygienic. So small mnemonic would be OH3 or O. Then food-borne diseases can be categorized into intoxications due to naturally occurring toxins like latharism, epidemic dropsy, endemic ascites, then bacterial toxins, fungal toxins like aflatoxins and ergots, and chemicals. Then we have infections which can be bacterial, viral, or parasitic. Then we also discuss what is food fortification. There's a WHO definition for food fortification and various criteria to be fulfilled to call a food item as fortified. And then Food Adulteration and Prevention Act 1954, and food standards, what's the National Nutrition Policy, and Anemia Mukt Bharat. There are also various other community nutrition programs like vitamin A prophylaxis, prophylaxis against nutritional anemia, control of iron deficiency disorders, special nutrition programs, Balwadi nutrition programs, ICDS program, that is the Integrated Child Development Services program, the midday meal program, and the midday meal scheme. Midday meal program and scheme are, should I say, same but different. Like they have very slight differences, but they're more or less the same. So you need to know the principles of the midday meal program and the nutritional specifications and suggestions of the midday meal scheme. Lastly, we have a short note on the monitoring and evaluation of nutritional programs and how randomized control trials can be used to do the same. So that brings us to an end of this chapter. I hope this video is helpful in studying, and please do comment below if you liked it or if you have any suggestions. And of course, like, share, and subscribe, y'all. Thank you for watching. See you soon.